Hello everyone. Today we are going to learn the topic is liver biopsy. I am Minoli, tutor of Triple M College of Nursing. Understand what are the objectives we are going to discuss. So first introduction about the liver biopsy and definition and purpose and indication of the liver biopsy and contraindication and two method of liver biopsy and preparation of the trolley and procedure with the steps and nursing responsibility and then complication. Definition of liver biopsy. A liver biopsy is a medical procedure in which a small sample of liver tissue is removed for examination under a microscope. It is often used to diagnose liver diseases, assess the severity of liver damage, and guide treatment decision. So this suggests of the liver is not working properly. For example, blood test may show that the blood contains higher than normal levels of liver enzymes or too much of iron or copper, and X-rays could suggest that the liver is swallowed. So looking at liver tissues is itself the best way to determine whether the liver is healthy or a cause of damage. Coming to purpose and indications. So here to diagnosis and prognosis and possible line of the therapy, to confirm the presence of whether the hepatic tumor, for example hematoma, and to determine the cause of a hepatomegaly and know the state of liver in portal hypertension and liver cirrhosis, and to differentiate the active Crohn hepatitis from chronic persistent and aggressive types, and diagnose some systemic disease like sarcoidosis, lymphoma, and amyloidosis, and effectiveness of the therapy, example stages of alcoholic fatty liver after withdrawal, and progress of conditions by serial biopsies autoimmune hepatitis B. The contraindications we cannot do for the liver biopsy procedure. The first one is uncooperative and restless patient, and severe hemorrhage tendencies like blood dyschargia, and infections of the right lobe of the liver and the right lower lobe of the lung, and prolonged obstructive jaundice, like danger if lacerating dilated apparent bile duct on the surface of the liver, and the massive ascites. So these kind of the peoples we can't go for the liver biopsy procedure. Types of liver biopsy: percutaneous liver biopsy, transjugular liver biopsy, laparoscopic biopsy, fine needle aspiration, core needle biopsy, transplant liver biopsy, and open liver biopsy. The first one is the percutaneous liver biopsy. So here a needle is inserted through the skin and into the liver to extract the tissue sample, which is can be done with or without imaging guidance like ultrasound or CT, and this is used for diffuse liver disease, example hepatitis, fibrosis, and cirrhosis. And the risk for the percutaneous liver biopsy, sometimes pain, bleeding, puncture of surrounding the organs and thing will be there. And coming to the transjugular liver biopsy, a catheter is inserted into the vein in the neck, like a jugular vein, and guided in to the liver via the hepatic vein to obtain a tissue sample, always which is performed under the fluoroscopic guidance, and which is performed for patients with coagulopathy, ascites, or other contraindications to percutaneous biopsy. And the risk for this transjugular liver biopsies, like risk of bleeding, and but more technically complex. And coming to the laparoscopic biopsy, here the physician insert the special tube called the laparoscopic through and incisions in the abdomen. The laparoscope sends images of the liver to a monitor. The physician watches the monitor and uses instruments in the laparoscope to remove tissue samples from one or more parts of the livers, and physicians use this type of the biopsy when they need tissue samples from the specific parts of the liver. Final most transplant liver biopsy. So here the performed on transplanted livers to monitor for rejection or recurrence of diseases, and usually which is percutaneous with imaging guidance only will happen. Preparation of trolley. So before the procedure, we have to collect all the articles like a dressing set and liver biopsy needle, which has two types. One is the suction needle and then cutting needle. For the suction needle, for example, Manhini and Jamshidi and glad skin, and a cutting needle, for example, true and cut one, and a spring loaded needle and sterile gloves, a povitone and lignocaine for 2% and elastolets. Before the preparation, first to explain the procedure and purpose to patients to allay the anxiety and gain cooperation, and to ensure the written consent is signed, and ascertain the results of below blood samples are available to make sure blood clot is properly. For example, PT, PPTT, HP, blood, and kept two units in reserves in case of hemorrhages, and LFT, AHS or CHS may be necessary. And ask the patient for any regular current medications regime, especially those that affect the blood clotting, like blood thinners. For example, that medications like aspirin, anticoagulant, like that. So these medications, 1 week before the procedure, patient will have to stop taking the aspirations in ibuprofen and anticoagulant medications, and administer the vitamin K for a period of 2 to 3 days prior procedure if patient has a prolonged PT and PTTT. So the patient must not to eat or drink anything for 8 hours before the biopsy. So as scheduled to arrive at the hospital about an hour before the scheduled time of the procedure, and instruct the patients to empty his bladder prior sending to procedures room. A distended bladder causes discomfort. Administer pre-medications if prescribed, such as mild sedatives medicines, and to take the record vital signs of baseline observations like respiration, pulse, temperature, and blood pressure to be checked. Procedure. The patient lies on their back with their right arms raised above their head to expose the liver area. The skin over the liver area, usually below the ribs on the right side, is cleaned and marked, and local anesthesia is injected to numb the skin and deeper tissues, and a small incision is made in the skin, and using ultrasound or CT guidance, the doctor inserts the thin biopsy needle into the liver to remove the small tissue sample. The patients must be asked to hold their breath briefly during the needle insertions to minimize movement, and the tissue sample is extracted and the needle is removed. Pressure is applied to the site to stop bleeding, and the area is bandaged. Nursing responsibility. Instruct the patients lie on right side pressed against to the well for 2 to 6 hours, and compress the liver against the chest wall near to the biopsy site, and monitor the patient's vital signs and level of pain closely, and inform the patient to ensure with the normal breathing as soon as the needle is withdrawn, and seal the puncture site, applies the dressing and strip with the elastoplast, and label the specimen and record the specimen and obtain the dispatch book, and send the specimen with the forms as soon as possible. Observe any complaints of abdominal pain or distension, and deepening of jaundice. The discharge advice have to give to the patient after the liver biopsy procedure. So first, advise the patient not to drive, and encourage the patient when reach home, rest in bed for 12 hours, and ask the patient not to carry any heavy things and put any weight on right hand for 1 week, and ask the patient not to take any coagulant drug for 1 week. What are the complications will occur after the liver biopsy procedure? The first, hemorrhage and puncture of the viscera and gallbladder and biliary vessels, and lead to bile peritonitis and lung, and give rise to pneumothorax and surgical emphysema, and gut, for example, lead to fecal peritonitis and sudden shock due to a condition similar to pleural shock and infection. this will be a very useful session, and the remaining parts will be seen in the next video. Thanks for watching.